And this comes from a recent paper by Miller and Rose that was an American Psychologist article, all about MI. What's really important here is that MI doesn't work when therapists move towards planning change early. So I will say there actually have been studies. There was one major study that found it was an RCT, really well conducted. Bill Miller was in charge of this RCT. It came out in the early 2000s, in the early aughts. And they found that in this great RCT, MI had no effect. None. Zero. No difference from control. And so at first they were kind of like, crap, what do we do? This is the best study we've done, and our effects all disappeared. And then Paul Amrain came along, who's a linguist, or still is, I hope. And he thought, I wonder if there's something going on in these sessions. Because what they noticed is that about 2/3 of the patients in their MI condition actually did show decreases in drinking over time. But there was this recalcitrant 1/3 that just refused to make any changes. And what Paul Amrain did was actually code or do some analyses of the language of what they were saying in sessions. And this is where that change talk at the end really comes into play. So, like I said, this was a big randomized control trial. There were lots of participants. And most importantly, they had a manual. And that manual said at the end of your motivational enhancement session, you should move to planning change. Right? It didn't say, it implied regardless of where your clients are, you should move to planning change. And so what they found was that for people who are not producing a lot of change talk throughout the session, when they went to planning change talk went way down, sustained talk resistance went way up, right? Because they moved to saying, okay, how are we going to fix this problem when the client hadn't said, I would like to fix this problem. The client was still sort of like, I don't know what to do. I don't know if I should change or not change. There's a lot of reasons why I should do both. Which, by the way, is how most of us feel when we're thinking about making a change. So this is where they sort of kicked off the let's look at change talk, because change talk is really important. And prematurely jumping to solutions when a client isn't giving the signal that they're ready is going to kill any hope for change that you might have. Okay, I want to try an exercise with you all. We're going to try to make it short. So I want everybody to do this. It's going to be loud, but we're going to do our best. So I want you to choose somebody next to you, which is a partner up to have a conversation with. Before you do that, before you start talking, hear me out, get the whole exercise, and then do this, okay? Hopefully not your boss, or supervisor, not somebody who... and one of you is going to be the speaker, and one of you is going to be a counselor, okay? So why don't you go ahead and quickly pair up. Somebody next to you, you're going to have a conversation with this person. And then find your partners, and then Alright, so back to me. So one of you is a speaker, one of you is a listener. Here's what I want the speaker to talk about. I want you to talk about, this actually goes back to, hopefully you're already primed for this, something about yourself that you want to change, you need to change, or you should change, or even something you have been thinking about changing but you haven't changed yet. In other words, something that you kind of feel two ways about. Now, again, this should be something that's appropriate to share. It would really be minor. It would be like, I'm trying to buy a car and I can't decide between the CR-V and the Subaru Outback. It really could be something, you think about switching political parties or something. Something that you're free to share, or that you'd be willing to share in public company. I'm not going to ask anybody what it is. You're not going to have to talk. Sorry, I tricked Rachel into doing that earlier, but I'm not going to trick you again. So whoever's the speaker, does everybody know who the speaker is? Raise your hand if you're the speaker. Let's figure that out first. Okay? All right, so we have our speakers. Speakers, that's your job. Something that you would like to change. Everybody got something in mind? All right, now listeners, here's your job. Or counselor. Let's call you the counselor then. So find out what change the person is thinking about making. That's your first job. Find out what they're thinking about making. And I'll leave this up because you have instructions. And then what I want you to do is to explain to them why they should make this change. I want you to give them at least 3 reasons. Come up with 3 reasons why they should make this change. And benefits that would result from making the change. Tell them how they can make this change. I don't need just 3. Emphasize how important it is for them to change. And persuade the person to do it. This is your job. I want you to try to utilize all of these techniques. I'll leave them up here on the screen. And if you meet resistance, do it again. Okay, I'll just give you a few minutes, like 5 minutes to do this. So go ahead and have your conversation. The most? Was it the speaker or the counselor? Raise your hand if counselor. Counselor. Right. If anybody's willing to share, what was it like to be the speaker for you? What did it feel like?
Listening.
You were just listening. Yeah.
Yeah, I didn't have to do much or anything. I just kind of sat there and nodded.
Yeah, it's actually kind of nice, isn't it? Yeah. What else did it feel like? Yes.
I was like, you don't know me.
Right, yeah. Like, oh snap. Like, right. Yeah. And for me, it always feels like I'm at my doctor's office. Yeah.
But a bit of lecturing.
Oh, lecturing. Yeah. Oh, yeah. Did anybody start feeling sort of angry or frustrated? Are people just not as reactive as I am? Right? Maybe feel sort of, yeah. And did people have that, like, you don't know who I am, you don't understand? Did anybody argue?
I didn't get angry or anything, but I felt like I came up with more excuses to not do it than I
Oh,
did.
yeah. Yeah. Oh, your butt comes out, doesn't it? In other words, you start saying but a lot. Your butt is all over the place. What about being the counselor? What was it like for you being a counselor? You talked a lot.
Kind of exhausting.
It was exhausting, right? It's a lot of work, isn't it? Yeah, right. Well, speaking of butts, you're at the back end of that horse with that butt. You're just pushing it, right? And every once in a while, it's not just the butt you have to deal with. Yeah.
You had to come up with something really creative right away.
Oh, yeah.
Kind of keep talking so she
Isn't that so much?
think of something.
Yeah. Isn't that so much pressure?
Yeah.
Yeah. It's a lot of pressure. You got to outsmart your clients. And we already showed when we tried to outsmart, and she had to hook up with Rachel too, which is even worse. 50 of us cannot outsmart Rachel. Right? It's hard. Okay, now, unfortunately, we don't have time, but what I usually like to do is reverse this exercise. So what is MI? At least what's some of the essence of MI? It would be asking the person why they think they might want to make this change or should make this change. It might be asking them to imagine what benefits they would get if they would make that change. It might be, rather than telling them, asking them, well, what have you thought of about making this change? Ask them, well, how important it is it for you to make this change? Sometimes English fails me good. And it definitely could not be persuading the person to do it. You can flip this script on its head and get some of the essence of motivational interviewing. It turns everything back to the client, and it encourages and tries to evoke from them their own reasons and motivations for why they might want to make a change in behavior. And indeed, this is the spirit of motivational interviewing. It's centered in client-centered listening skills and empathy. And on top of that, we add, this is sort of the gas of motivational interviewing. The research suggests that just having good MI spirit is unrelated to outcomes. We just had a vigorous debate on the MI listserv about this. But it is certainly something that fuels good MI practice. And what we're talking about is a spirit of collaboration. We're guiding, moving alongside our clients. We're evoking change talk and change from within. We're not trying to push it out of them or pull it out of them. We're trying to have it come from them. We're not giving them anything. All we're trying to do is provide an interaction, a dynamic, an environment where they feel free to start coming up with their own reasons about changing. And it's all about supporting autonomy. So your client comes in and they want to quit smoking, and you have lots of great ideas. Who's going to be taking their Chantix every morning? Who's going to be having the nicotine patch stuck on them? Who's going to be smoking the replacement cigarettes? Not you. Who's going to keep the drink out of our alcoholic friends' hands? Who's going to sit with them during the Super Bowl and keep them occupied so that when they get that craving for that Budweiser with all that advertising, who's going to keep them from drinking? Are you going to strap them down? Are you going to follow them around every moment? No. So the spirit of MI recognizes that you have to have two experts in a room to have anybody change. One is the expert on behavior change or on some sort of specific topic, and the other is the expert on the patient. And conveniently, patients always bring that expertise with them. So we can think about motivational interviewing as having a couple of stages. The first stage of motivational interviewing is client-centered. It's entirely client-centered, and what you can ignore the vote at the bottom, but I just thought I'd pick some rowers. Because we can think about motivational interviewing as sort of like rowing a boat. And the first thing you have to do to be able to move a boat, if you don't have a sail or some wind, you need some oars. And these are the basics of good client-centered skills. This is not specific to MI, but it is the basis and the first part of these micro skills that you need. So these oars, open-ended questions, affirmations, reflective listening. Reflective listening really is actually the basis of MI. Reflective listening is really where good client-centered skills come from. But it should be surrounded by these open-ended questions, affirmations, and summaries. We summarize what the client is telling us. So what do each of these look like? These are just some examples. So we want a lot of open-ended questions because they keep the client talking. And when the client talks, we have material to work with. When the client talks, we don't have to work hard. We don't have to push the back end of the horse. We don't have to come up with better solutions than they do. We keep them talking. It's usually good. So open-ended questions where we say, like, how does smoking play a role in your as a lead singer in a chorus, for example? How do you feel about smoking? Rather than, well, how many cigarettes did you smoke today? So especially the psychologists who are early in their training, they get lots and lots of training and assessment and asking lists and lists of questions and creating checklists before their session about everything they want to accomplish when they go into that session. Good MI practice is not about checklists. It's not about closed-ended questions. It's not about getting the information that you care about. It's about getting the information that's important to the client to talk about. Reflective listening. I think everybody here probably has at least some sense about good reflective listening. And reflective listening can be anything from a very simple mirror reflection where you literally repeat what the client says to you, to very complex reflections where you reflect multiple sides of a person's ambivalence, or you reflect cognitive meaning or emotion, or you even have strategic reflections where you might amplify the emotion that they're communicating to you or try to dampen it. Affirmations are key, where we give, and affirmations are different from cheerleading and rah, rah, rah. Affirmation is is this promoting and supporting efficacy in clients. And then summary statements is sort of the final final thing where you're sort of giving the person back a bouquet of all the things that they've said, and we think about this actually as collecting a bouquet of statements. So a lot of times we think about collecting a bouquet of change talk.